Hello all, welcome back to our channel. In this video, let's see a topic related to NMC guidelines, and it would be part of your GS2 paper for UPSC as well as for other civil service exam preparation. Recently, National Medical Commission, that is NMC, released guidelines for doctors that creates furore all across India in medical community. Let's see it quickly. Rule number 1, that is judicious usage of social media. Nowadays, we are seeing many doctors are appearing in YouTube, Facebook and providing medical solutions to variety of health issues. In fact, few doctors are coming on YouTube live and ask the patients to tell their problems through comment section, and they are immediately prescribing them specific branded tablets or syrups in a public manner. This is really unfair and it may mislead the common people who are watching those videos. To overcome this menace, National Medical Commission says, hereafter, if any registered doctor appearing on social media and giving solution to health issues means, that procedure should be a verified one as per NMC Code of Conduct. A doctor must not suggest any other variety of treatment procedure for experimentation purpose or for gaining popularity. Also, NMC clearly said the showcasing of X-ray report or scan report of any other patient through video and explaining the disorders through that scan report or something is clearly prohibited. No doctor should disclose a patient's detail and their diseases or their disorders either directly or indirectly via social media. Next rule is related to refusal of treatment by doctors. Let's say either a patient or relatives of that patient behaves in an unruly manner. If they react violently to doctors, the doctors have a right to refuse the treatment of a patient at any stage. Third important rule, which really stirs the medical professional, is hereafter a doctor should prescribe generic medicine only, not a specific medicine. Which means, let's say you have fever and you are going to doctor's clinic. As per this rule, the doctor should prescribe paracetamol tablet in the prescription sheet, not specific name or brand like Crozin or Calfol or Dolo, etc. These specific rules create so much of discussions and debate recently. Let's see why NMC has brought this rule at first. We know the main role of medical representative, or we shortly call them as medical rep, is to convince doctors to prescribe the company's brand or its manufactured medicine to patients. If doctors are satisfied, they too prescribe the same medicine to us. This is what happened so far. The problem is, there are few pharmaceutical companies with its ambitious desire to increase its market value. They are in fact bribing the doctors through money or providing costly medical equipment free of cost to doctors' clinic, and most importantly, they are fully sponsoring the medical conferences. Thus, by having doctors and famous hospitals in their hand, few pharmaceutical companies are selling substandard and untested medicines in the market. In order to completely prohibit this pharma lobby, NMC has brought out this rule. Further, it clearly says, hereafter pharmaceutical industry cannot sponsor medical conference and doctors should not get gifts or commission or endorsement from these pharmaceutical companies. Apart from that, it set an important guideline, that is, hereafter a doctor should write the prescription only in a legible capital letters. It is really a welcome move. As a patient, we cannot decode the cryptic prescription of doctors and only pharmacy staff can decode that one. Hereafter, as a patient, we too have a right to know what clearly mentioned in our prescription sheet. This rule seems so legible, right? But doctors have different viewpoint. Let's say, as per this rule, a doctor prescribes paracetamol for a patient who has fever. If a patient goes to a medical shop, which paracetamol tablet to be given to a patient is decided by pharmacy. A pharmacy staff may give either Dolo or Crozin or Calfol. Thus, these pharmaceutical industries easily persuade those pharmacies for their favor and easily supply their untested, substandard stock of medicines to their patients. Before this rule, at least some accountability is there with the doctors, but now that too diluted very much. Thus, doctors say, this specific rule will easily give way for pharma lobby to gain in unethical manner. This point of view also seems right. If so, what's the solution? The motive of NMC against pharma lobbying is really appreciable, but the modus operandi against this drive is somewhat substandard. Instead of restricting the pharmaceutical industry which manufactures substandard medicine, targeting doctors is not a fair solution. NMC should look into it and address this issue properly. And fourth rule is related to continuous professional development. It says a doctor should not stop upgrading his medical knowledge after completing his degree. During his active service period, for every 5 years, a doctor should learn new things allied to medical sciences and should earn up to 30 credit points for every 5 years. So these are all the important rules put forth by NMC recently, and this topic would be useful for your civil service exams, prelims as well as for GS2 Mains. Make a note of the keywords displayed on the screen that would be helpful in writing practice. Please subscribe this channel for useful content and share this video to your friends. See you all in another video. Bye.